The demand for eye care is increasing. We've got an ageing population. We've got fixed capacity in the hospital. We've got waiting lists that are getting longer. So really, we needed to look at different ways of working.
The Transforming Eye Care Services Wales project is trying to see if the overburdened ophthalmology services in the hospital can be helped and relieved a bit by utilising the skills of the appropriately qualified optometrists in community care.
What we're hoping is that we'll be able to use some of the outcomes from the project to demonstrate what a valuable resource primary care optometrists are.
The Clinical Innovation Accelerator at Cardiff University has played a key role in helping us engage with high street optometrists early on in the process to secure a long-term commitment to patient recruitment, data collection and service evaluation, which is the core of the project. They have also played a vital role in the development, implementation and maintenance of a comprehensive database for storing our patients' reported experiential data.
So at the end of this, we want to see increased capacity in the hospital. We want to see our waiting times reduced to a minimum. And we just want to make sure that patients receive safe and timely care. The Accelerate team were able to say to us, this is how you can achieve your objectives, and put it in a very clear structure, a very clear time frame. They put us in touch with all the right people that could support the project.
One of the biggest contributions has been the provision of a research associate, Angharad Hobby, who has undertaken the patient and practitioner evaluation. This includes ethics approval, dissemination, analysis and reporting of patient experience outcomes.
So taking patient and practitioner experiences and outcomes into account as part of a service means that our research outputs and reports can be used to influence decisions on provision of healthcare in the future.
What we're using is a newly developed electronic patient record. Optometrists in every practice in Wales will have access, and not only will we have access, we're able to read and write into that record. So instead of those patients attending University Hospital of Wales, Cardiff, they'll have their assessment performed in optometry practices on the high street. So we can see patients in the community take their results, take their images, upload those images to this shared electronic record, and a consultant then straight away can see, right, this patient's got these results, that's fantastic, that's stable, I don't need to see that patient now in hospital, I don't have to bring them in, that's fine, you can be monitored now in the practice in 12 months' time.
When we do have research, we're able to use that as evidence around how we can actually implement things across Wales. Welsh Government are really keen to take those findings and translate them across to the other health boards that we work with in Wales.
We're trying to do something that no one else in the world has attempted, using new systems, using new software, new technology, and already we're talking with them about, okay, so what's next?
Without the expertise from the Accelerate team, we would never have been able to do this.
I think they're the glue between all those different collaborators. Explain your idea, explain exactly what you want to do, and then they will work with you to formulate that into a very detailed plan that we couldn't have done by ourselves.
To find out if Accelerate can help turn your ideas into reality, visit our website or email us at accelerate@lshubwales.com or call on 02920 467 030.